5 years ago, I went to an orthopedic doctor thinking I had arthritis in my right leg because I had started to sort of drag the leg, and my legs felt very heavy, like I had no control, like I was walking through molasses. You know, you have that feeling.
My wife had noticed, before I even realized it was happening, my speech was slurred. And my sister noticed slow movement in my left leg, like I was dragging my left leg. So these things were upon me before I even realized that it was happening to me.
Life does go on, and you can do things. And the disease is going to be there, but you have it under control, and you're going to cope with it, and you know, you live every day to the utmost.
We don't know exactly the cause or causes of Parkinson's disease, but we know a lot of the factors that play a role. And the ultimate end result is that a group of cells that make the transmitter dopamine get sick and slowly die. And when you lose a critical threshold of that function, which is about 60 to 80%, that's when the symptoms begin to emerge.
At that point in my life, I was totally shocked because I had no idea, you know, that anything like that could happen to me. And I'd taken care of myself, and I didn't know exactly, you know, what to expect.
This is a very slowly progressive disease, and you don't have to be afraid that you're going to all of a sudden become completely disabled.
Our strategy, our long-term strategy, is to keep that patient functioning normally for as long as possible, and many of these patients are able to live a full and near normal life. And I think that's a very important concept, because when a patient with relatively mild Parkinson's disease begins to read about Parkinson's disease, they're really reading about the problems that are encountered by patients who have relatively severe and more advanced disease.
What he explained to me was that it was a chronic neurological disorder that goes on and probably gets worse as time goes on, but that there were treatments for it, and he felt that with the treatments that he was going to prescribe for me, that I could pretty much lead a somewhat normal life.
When patients first start taking medication, you have to start with a single dose and then gradually build up. And it's a matter of taking a little bit from here and a little bit from there. And it's like making a cake and not knowing quite what the recipe is. You have to choose your drugs carefully. You have to choose the timing of your doses carefully. And you have to also deal with it in relationship to how well the patient is going to respond to your instructions.
The dose that we're starting out with is not one that we have an expectation will give them symptomatic relief. That the goal is to get them to tolerate the medicine. And then once they tolerate the medicine, increasing it to a point that they will get some therapeutic relief.
There must be input from all sides, and this is what came through with Dr. Leopold and Bobby Herkat at the clinic, that we were a team. Whenever I went in there, they asked me how I was feeling, how this was doing, how that was doing, how this was doing. How do you feel on this much of the medication? Do you think we should give you more? And there was always looking for input from the patient, which I thought is very, very important.
We don't know what causes Parkinson's disease, although we've learned an awful lot in the last several decades. We know, for example, that a chemical called dopamine, which is manufactured in the brain, becomes deficient in patients affected by Parkinson's disease, so that our pharmacologic treatment of the disease is based predominantly on dopamine replacement.
Dopamine itself doesn't get across the blood-brain barrier, so we end up treating them with the precursor for dopamine, levodopa. It is only a symptomatic treatment. That is to say, it only treats the symptoms of the disease. In that regard, it's extremely valuable.
There is a particular motor disability that patients of Parkinson's disease who take carbidopa, levodopa get, and that is an off dyskinesia, or an off dystonia. And if you can add another drug so that you can reduce the amount of levodopa, then this off dystonia becomes less prominent, and the patients are often much less symptomatic from that.
So L-Dopa is a mixed blessing. Yes, it's the most effective medication, But the long-term adverse effects associated with L-DOPA can, in their own right, be very disabling.
It's as though you had a leak in a bucket that was containing water. What we're doing is replacing the water, but what we're not doing is patching up the leak. Now, as long as you can satisfactorily replace the water, things are pretty good. But eventually the leak grows and water replacement is unsatisfactory. And that's what happens with levodopa.
And there are a variety of side effects that we must deal with on a daily basis with some of the patients, particularly the ones that are more advanced in their disease.
When a patient asks me about the side effects of a medication that they're being newly prescribed, I tell them that all medication has side effects. There isn't any medication that they can take that does not have a potential for side effects. And whether they get that side effect or not is very unique to them and very individual to them.
They're symptomatic enough from their Parkinson's disease. You don't want them to be symptomatic from their treatment of the Parkinson's disease.
Requip changes the playing field because it gives us another drug in the armamentarium of dealing with this annoying disease. And it gives us a chance to put somebody on it that may have failed other drugs.
We tend to be more judicious in our use and therefore try to use as little levodopa as possible. And that's why drugs like Requip and other dopamine agonists are useful to us. They add another choice for us. The more choices we have for the patients, the better it is that we can manage those patients.
It reduced my tremors, improved the movement on my left side. This is a dating order, April, May, June. Yes. Improved my speech without any side effects. With Cinemet, Cinemet does control the symptoms somewhat, no doubt about it, but I've had side effects with Cinemet that I did not have with Requip. And by not having these symptoms, I think it showed that I was in control of everything that was going on, and I was fine. And as a result of that, I was able to continue on in my duties. As president of the Springfield Township Zoning Board, I have to sit as a hearing judge, listening to people seeking variances and special exceptions and businesses looking to expand. And I think people appearing before me felt a lot more confident with me, seeing me under control of my situation.
As I began taking the Requip along with the L-DOPA, I found that I was able to manage my level of activity on a more level playing field. For instance, I wouldn't have the peaks and dales that I would have with just L-DOPA, whereas the energy would run out much more quickly without the additional Requip.
And people had very little off time. They had very smooth days, and that was very exciting to see.
In the category where the drug was used on top of coexisting drugs, I was able to back off some of the patient's medication, primarily their levodopa, carbidopa doses. And in doing so, those patients were able to maintain satisfactory improvement on lower doses, and therefore I think the drug is a benefit in that area. In general, the patients tolerated the medication very well.
It was very easily tolerated by people, and they got significant symptomatic relief, and I was able to reduce their Cinemet to a very low level and did very, very well.
I noticed that when I took the medication on an empty stomach, I would feel nauseated and sometimes lightheaded, but I thought maybe it was a problem with hypoglycemia, but then of course I felt that with experimenting I would take the medication with food, and I felt better, and I felt better taking 6 small meals rather than 3 large meals.
So there were less complaints when we were giving Requip, and so it made their life easier. The patients themselves liked Requip because the things that they were aware of were not occurring, so they were much more pleased. So when they felt better, they were willing to participate, so that certainly made their caregiver's life a lot easier and their quality of life better.
I hope the addition of the Requip helps me to maintain my lifestyle the way it is now, and hopefully other people will be able to enjoy the effects that I have. And I think you have to have like a positive outlook and feel that Requip is helping you, and you have to help yourself. And those two factors join hand in hand, and that'll make your life much more easy to cope with.
I'm still doing the same things for the kids that I did before, picking them up at school when they have early dismissal or whatever the case might be, or taking them out to practice for football or soccer. And so they're not treating me any different today, which I think is important, because I don't want to be treated as someone that's a burden or expected to become a burden. I want to be treated just as a regular guy, and I hope that continues. And continue on with your life as you did in the past, and I think you'll be much better off doing that than rather than just sitting around and letting the disease take control of you.
Maintaining as normal a lifestyle as a person can is the most important thing that you can do. Focus on what you can do, anything else, and it's the best medication you could possibly give.